If you have one of these insurers, be mindful of where they are ranked. They could just deny it and list it as other and not end up really telling you why. You are paying very little in your monthly premium, an extremely high deductible, risking a higher denial rate, in network denial rates as high as 54%. Hello, YouTube. My name is broker Evan Pollard, licensed in life, health, accident, and sickness in both North Carolina and Arizona at the time of this video. As always, I have some news for you guys, just updating you on things that you may not see on the regular basis, but I am here bringing it to you just because that's what I do. So I'm going to go over a few things today just to round it up. Let's get straight into it. The first article that I have for you guys is pulled up from the Kaiser Family Foundation, which we love KFF over here. They give us all the stats. And if you guys already know from the previous videos that I do, a lot of the articles that we go over derive some of their sourced information from Kaiser. They are coming out with a lot of data for 2023 now that 2024 has ended, and you would think that they would also include 2024 information, but for the most part, we are going over 2023 information as this has been published yesterday. From the day I'm recording, it is the 28th today. So for me, this is yesterday. As it states, healthcare.gov insurers denied nearly 1 in 5 in-network claims in 2023, but information about reasons is limited in public data. As it states, healthcare.gov insurers denied nearly 1 out of every 5 claims, 19%, submitted for in network services, and an even larger share of 37% of claims for out of network services in 2023. And I guess the most important part of this article that I wanted to point out is that the analysis finds a huge variation across healthcare.gov insurers, which had in network denial rates as low as 1% and as high as 54% in 2023 in some states. Insurers of qualified health plans, QHPs, sold on healthcare.gov denied 19% of in network claims in 2023 and 30% of out of network claims for a combined average of 20% of all claims. And if you are a visual learner, here is a beautiful, wrong way. Here is a beautiful graph that explains to you how many claims were paid and denied. The in-network denial rate ranged from 1% to 54%, as I just read, and there was a significant variation by insurer and by state. Now, based on this chart right here for the denial rates for in-network claims by healthcare.gov insurers, it doesn't seem like it changed too much, but we did see a slight uptick in denial rates for the claims in 2023 versus prior years. Of limited information available on in-network claims denial reasons, the most common reason cited by insurers was other at 34%, followed by administrative reasons at 18%, and then excluded service at 16%. And the lack of prior authorization or referral was at 9%, and only 6% was based on lack of medical necessity. So remember, the carrier can deny a claim for a plethora of reasons. It could be a lack of prior authorization or referral, out of network provider, to an exclusion of service, denial based off of medical necessity. You've reached your enrollee benefits. You possibly aren't covered for that certain service. It could be a denial due to a cosmetic procedure or one that could be deemed experimental as well. They have administrative reasons, duplicate claims, missing information, it's untimely. It could also be unapproved by your provider. And then there's other reasons that would fall under the administrative category as well. And then I guess there's the miscellaneous reasons that they could just deny it and list it as other and not end up really telling you why. Next bullet point reads, consumers rarely appeal denied claims. Fewer than 1% of denied claims were appealed. And when they do, insurers usually uphold their original decision. 56% of appeals were upheld. And And lastly, marketplace enrollees filed 5,000 external appeals in 2023, or 3% of all upheld internal appeals due to the suppression of small values. The rate at which external appeals were upheld could not be calculated. If you're wondering where your insurer lands and you are in a federally facilitated marketplace state, you can see right here where all of them are ranked. And as you see, for number one, Blue Cross Blue Shield of Alabama with a 35% denial rate. Then you have United Health Group, number two, at 33%. Healthcare Service Corporation, 29%. Molina Healthcare, 26%. Elevance Health, 23%. CVS, 22. Blue Cross Blue Shield of Tennessee, 21. Cigna Health, 21. CareSource, 21. Scott and White, 19. And the list goes on. If you have one of these insurers right here on the marketplace, please be mindful of where they are ranked. And if you're curious about the average denial rates for in-network claims for the healthcare.gov insurers by state, here's your chart right here. It looks like the state-based insurers are blanked out right here in the pinkish peach color. So you're not going to see the rates listed on this map right here for those states, but every other state that is on the federally facilitated marketplace will show up in either the green to blue hue for the stats. But it doesn't stop there. It also depends on what level of plan you are on. As you know, if you watched my ACA 101 video, I did a breakdown for you of each plan type that you are allowed to purchase on the marketplace. That goes for all states, including state-based insurers as well. You have those 5 levels right there: catastrophic, bronze, silver, gold, and platinum. Usually you're going to see people enrolling in catastrophic if they are under the age of 30, but most popular is going to be silver, only because you have the ability to do the cost sharing reductions in that plan as well. And we also see with the catastrophic plans, which again, these are going to be the younger people, getting a denial rate of 27% if you have catastrophic. Now, the bronze, silver, and gold are so close that you wouldn't necessarily say that there's too much of a difference there. But definitely, if you have the catastrophic plan, please be mindful. You are paying very little in your monthly premium, but you have an extremely high deductible. And on top of that, you are also risking a higher denial rate for your claims under that catastrophic plan. Let's talk a little bit about Medicare Advantage as the last topic of today's video. And because I love KFF so much, as KFF also states that Medicare Advantage insurers made nearly 50 million prior authorization determinations in 2023. I like to go over the key takeaways for the articles just because it summarizes it all for me in one snapshot. So, number one, Medicare Advantage insurers made nearly 50 million prior authorization determinations in 2023, reflecting steady year-over-year increases since 2021, which was 37 million, and then in 2022, which was 42 million, as the number of people enrolled in Medicare Advantage has grown. Next bullet point, in 2023, there were nearly 2 prior authorization determinations on average per Medicare Advantage enrollee, similar to the amount in 2019. And with prior authorizations on Medicare Advantage, you're usually going to see or need a prior authorization for the higher cost services. That's going to be like your inpatient hospital stays, your skilled nursing facility, chemotherapy. And prior authorizations are steps put in place to make sure that the service that you're requesting is medically necessary, thus requiring approval before the service is acquired. Let me go back to the article really quickly because there is one part of the article that, raises alarm bells, which I don't know. Did I cover this? I think I did with United, because United is one of the top processors providers, and they use AI. At the same time, prior authorization processes and requirements, including the use of AI to review requests, may result in administrative hassles for providers, delays for patients in receiving necessary care, and in some instances, denials of medically necessary services such as post-acute care. AI has been playing a huge role in a lot of instances in our lives, and artificial intelligence is one reason why a lot of claims have been getting denied, and most of the time, people aren't even disputing them. Appealing them. Okay. Appeal is the proper term, but a dispute, it's pretty much the same thing. In 2023, insurers fully or partially denied 3.2 million prior authorization requests, which is a somewhat smaller share of 6.4% of all requests than in 2022, which was 7.4%. A small share of denied prior authorization requests was appealed in Medicare Advantage, 11.7% in 2023. And lastly, though a small share of prior authorization denials were appealed to Medicare Advantage insurers, most appeals, which is 81.7%, were partially or fully overturned in 2023. Anyway, it is getting late in the day. I just came back from Tasty Tidbits Tuesdays, and I am just so much going on. Food demonstration, cooking class, doing the presentation, doing the cooking, the sampling, all that fun stuff, answering questions, going through healthy eating habits, meal prepping, all that good stuff. And if you want to join and you're in the Raleigh-Durham area, or if you're at least in Raleigh and you don't mind traveling to Durham, but at the same time, I'm going to be bringing these classes to Raleigh as well. So just be on the lookout. Be on the lookout. Okay. You can visit my Facebook, Broker Pollard, my Facebook page, where you will find some of the events that I'm posting on there. And I also have the booth for the Expos for Seniors on March 26th from 10 a.m. to 1 p.m. at Kerr Family YMCA in Raleigh, Wake Forest. And if you want to see me, come and say hi. Okay. I thank you so much for joining me for my bit of news today, YouTube, and I will catch you guys next time.